Tonight in your health news, it's called the silent killer because most people aren't even aware of the disease. Tonight, we're talking about venous thromboembolism, or VTE, and if you haven't heard of it, you're not alone. Dr. Mitchel Goldman from UCSD is here now to talk about what this disease is and what to watch out for. As always on Tuesdays, thank you so much for being here.
Nice being here, Kathleen.
Well, certainly, as I butchered it, we know it's hard to pronounce, but what exactly is venous thromboembolism and why is it so important to have it on our radar?
Well, a better word you could use is deep vein thrombosis, or DVT. And what happens is you develop blood clots in your legs usually, but it can be in other blood vessels of the body. And the reason I want to talk about it now during the holidays is this is a time when we're traveling around. And there's a number of different reasons why you will develop a blood clot. One of the reasons is that you're sitting in a plane or a car for long periods of time. Also, if you're obese, also if you're taking birth control pills. And so there's a lot of different factors like the straw that breaks the camel's back. When the blood is slowing down its flow, when the blood vessels are damaged, like if you have varicose veins that have been kicked or injured, the blood is going to clot up. And the problem is that those clots can then spread to go into your heart and your lungs and elsewhere, and they can become fatal.
So let's talk about those symptoms, because obviously you need to not be sedentary and be up and moving around to kind of sort of stave this off. But these are some telltale signs that you might be in some trouble here?
Yes. Now, many of us have this at some point during the day. You know, how many of us always has a little bit of veins on our legs, and some people, our legs are tired, especially if we're moving around. But if you have all of these symptoms, like the skin feels warm, especially if there's pain and it's swollen, or you have a red streak going up the leg, that's when you need to see your doctor before the blood clots actually get to your lungs.
So it only happens in your legs, Dr. G? It can't happen in your arms or?
It's very unusual to happen in other parts of the bodies, like your arms or in your pelvis. It mostly happens in the leg veins. But the problem is when those blood clots get into the heart or the lungs, then things get worse. You have trouble breathing, your heart rate starts accelerating, you can have chest pain, and that means you actually have a blood clot in the lungs. That's when you need to go to the emergency room and the hospital, and then there are a number of different things that the doctors can do to dissolve the blood clots.
Well, who's at greatest risk of developing this in the first place? You mentioned obesity. What else is a factor?
People that are on birth control pills, people that smoke, people that are sitting for long periods of time and not exercising, and then people with a history, a family history of blood clotting disorders. Now, one of the other things is if you have cancer. So people that have cancer, their blood is also predisposed to clot. And I've seen a number of patients that sometimes their cancer is in remission, but they develop blood clots, and that's the first sign that the cancer has actually come back. So these are all symptoms and that we should take seriously.
All right, Dr. G, and very timely, as you said, if you're sitting on a plane for a long time, make sure you get up and move around at some point and things like that.
Absolutely, and exercise. And you can also wear compression stockings.
Oh, and a good idea there as well. Thank you for that tip, and happy Hanukkah to you, Dr. G. Thanks for being here.
And happy holidays.